Neuroanatomy and physiology of the vestibular nerve play a crucial role in understanding the pathophysiology of vestibular schwannomas. These tumors, also known as acoustic neuromas, arise from Schwann cells of the vestibular nerve within the internal auditory canal. As medical students, it is important for us to grasp the intricacies of this condition, including the radiological correlates, diagnostic challenges, and treatment options. In this script, we will explore various aspects of vestibular schwannomas, ranging from their anatomical features to emerging therapeutic approaches, and conclude with an understanding of differential diagnoses and the overall impact on patients' quality of life. Understanding the neuroanatomy and physiology of the vestibular nerve is crucial for comprehending acoustic neuromas, vestibular schwannomas. The vestibular nerve originates from the vestibular ganglia in the internal auditory canal and is comprised of the superior and inferior vestibular nerves. These nerves transmit sensory information from the vestibular apparatus in the inner ear to the vestibular nuclei in the brainstem. The vestibular apparatus includes the utricle, saccule, and semicircular canals, which detect head movements and maintain balance. Schwann cells play a vital role in supporting and myelinating vestibular nerve fibers. Unfortunately, neoplastic transformation of these cells can lead to the development of vestibular schwannomas. Vestibular schwannomas disrupt normal vestibular nerve functioning as they grow, resulting in symptoms like hearing loss, tinnitus, vertigo, and imbalance. A deep understanding of the neuroanatomy and physiology is necessary for accurate diagnosis and management of vestibular schwannomas. Radiological imaging, particularly magnetic resonance imaging, MRI, with contrast enhancement, is crucial for diagnosing and monitoring vestibular schwannomas. MRI provides detailed information about tumor size, location, and its relation to adjacent structures. The Coues grading system is used to classify tumors based on their growth within the internal auditory canal and cerebellopontine angle. Specific radiological features, such as the presence of a dural tail, central necrosis, cystic components, and enhancement pattern, can help distinguish vestibular schwannomas from other conditions. Advanced imaging techniques like diffusion-weighted imaging, DWI, perfusion MRI, and magnetic resonance spectroscopy, MISS, provide additional insights into tumor behavior, vascularity, and metabolites. Biomarkers, including proteins, genetic mutations, and microRNAs, are being explored as potential tools for confirming diagnosis, predicting tumor behavior, and assessing treatment response. Ongoing research aims to determine their clinical utility in improving patient outcomes and developing personalized treatment approaches. Bilateral acoustic neuromas, which occur in both ears, are rare and pose unique diagnostic challenges. They can be sporadic or linked to neurofibromatosis type 2, NF2, a genetic disorder causing multiple nervous system tumors. Symptoms of bilateral acoustic neuromas differ from unilateral cases, including hearing loss, tinnitus, vertigo, balance issues, and other cranial nerve deficits. Diagnosing them can be difficult, necessitating a high level of suspicion, thorough evaluation, and detailed imaging, such as brain and spinal cord MRI scans. Early detection is crucial, and treatment options range from surgery to radiosurgery. Genetic counseling and surveillance are vital for managing NF2. Advancements in microsurgical techniques have revolutionized the management of acoustic neuromas. Surgical goals involve complete tumor removal while preserving neurological functions, especially the facial nerve. Selection of surgical approaches like translabyrinthine, retrosigmoid, and middle fossa depends on tumor characteristics and patient-specific factors. The translabyrinthine approach is ideal for large tumors involving the cochlea and semicircular canals due to its excellent exposure and visualization. The retrosigmoid approach provides a wider field of view and can preserve hearing in certain cases. The middle fossa approach allows for tumor removal while preserving cochlear nerve function. During surgery, techniques like auditory brainstem response and facial nerve monitoring aid in preserving neurological function. Advanced technologies like neurophysiological monitoring and image-guided navigation further enhance surgical precision and outcomes. Post-surgery, monitoring for complications and rehabilitation, including vestibular exercises and physical therapy, are critical for patients to regain balance and functional abilities. Stereotactic radiosurgery, SRS, has emerged as an effective alternative treatment modality for small to medium-sized vestibular schwannomas. This non-invasive technique delivers a focused high dose of radiation to the tumor, aiming to arrest tumor growth while preserving neurological function. This procedure, often performed using a gamma knife or a linear accelerator, relies on precise imaging and targeting techniques to deliver radiation in multiple beams. The goal of SRS is to induce tumor cell death and reduce tumor size progressively over months to years through mechanisms such as necrosis, fibrosis, and vascular changes. SRS is particularly suitable for patients who are elderly, have significant comorbidities, or have tumors that are not amenable to surgical intervention due to their location or size. However, long-term follow-up is essential to monitor tumor response, potential radiation-related complications, and to ensure ongoing preservation of neurological function. Preservation of facial nerve function is of utmost importance during acoustic neuroma surgery. The facial nerve, which courses through the cerebellopontine angle, is susceptible to injury during tumor resection due to its intimate relationship with the tumor. Intraoperative facial nerve monitoring plays a critical role in real-time assessment of the nerve's function during surgical manipulation. This monitoring can be achieved through direct stimulation, recording of electromyographic, EMG, responses, or by monitoring compound muscle action potentials, CMAP. These techniques help surgeons identify the facial nerve, guide dissection, and ensure its integrity during tumor removal. Several strategies are employed to protect the facial nerve during surgery, including the use of microsurgical techniques, minimizing tissue manipulation, and meticulous anatomical dissection. In cases where the nerve is irreversibly damaged, nerve grafting, nerve transfer, or dynamic techniques such as facial reanimation procedures may be considered for optimal functional recovery. Acoustic neuroma-associated vestibulopathy refers to the disruption of the vestibular system's normal function caused by the presence and treatment of vestibular schwannomas. Patients with acoustic neuromas often experience various vestibular symptoms, such as vertigo, imbalance, and disequilibrium. Effective rehabilitation strategies are essential for optimizing balance and functional outcomes in these patients. Vestibular rehabilitation therapy, which includes specific exercises and maneuvers, helps compensate for the loss of vestibular function and reestablishes stability and motor control. Physical therapists with expertise in vestibular rehabilitation play a significant role in assessing patients' functional limitations and developing tailored treatment plans. These plans typically consist of exercises that improve gaze stability, enhance balance, and promote postural control. In some cases, additional interventions, such as the use of assistive devices or gait training, may be necessary to achieve optimal functional recovery. Recent advancements in genetic and molecular techniques have enhanced our understanding of vestibular schwannomas. Multiple genetic mutations have been identified as drivers of tumorigenesis, particularly in NF2-associated and sporadic cases. The most common mutations encountered in vestibular schwannomas include alterations in the NF2 gene, which is known to suppress tumor growth. Studies have also revealed additional genetic abnormalities contributing to tumor progression and resistance to therapies, such as mutations in the SMARCB1 and TRAF7 genes. Additionally, molecular profiling techniques, such as next-generation sequencing, NGS, and gene expression profiling, have provided insights into the molecular pathways involved in schwannoma development and progression. These pathways include neurofibromin signaling, EGFR overexpression, as well as alterations in integrin-mediated signaling. Understanding the genetic and molecular profile of vestibular schwannomas may help pave the way for targeted therapies, individualized treatment strategies, and improved prognostication. Vestibular schwannomas and their treatment can have a significant impact on patients' overall quality of life, (QoL). The symptoms associated with acoustic neuromas, such as hearing loss, facial weakness, and balance disturbances, can lead to physical, psychological, and social challenges. QoL outcomes are influenced by various factors, including tumor size, the extent of hearing preservation, facial nerve function, and the choice of treatment modality. Studies have shown that surgical resection, when successful in tumor control and nerve preservation, can lead to an improvement in hearing and QoL. However, patients who undergo surgical interventions often require significant postoperative rehabilitation and experience challenges related to facial nerve recovery and vestibular rehabilitation. Patients treated with SRS may also experience delayed effects of radiation, including hearing loss and tinnitus, which can impact their QoL. Ongoing research is exploring innovative approaches to optimize post-treatment QoL in acoustic neuroma patients, including the development of novel rehabilitation strategies, psychoeducational interventions, and support networks. Regular surveillance plays a crucial role in the management of vestibular schwannomas. Timely detection of tumor growth or recurrence allows for appropriate intervention, leading to enhanced patient outcomes. MRI remains the imaging modality of choice for surveillance, enabling visualization of tumor size, location, and response to treatment. The frequency and duration of surveillance depend on multiple factors, including the patient's symptoms, tumor characteristics, and treatment modality. Generally, patients are monitored every 6 to 12 months in the early years post-treatment and less frequently as the tumor demonstrates long-term stability. Emerging imaging techniques, such as functional MRI, fMRI, and diffusion tensor imaging, DTI, hold promise in providing additional information on tumor metabolism, functional connectivity, and nerve fiber integrity. These techniques may aid in more accurate prognostication, treatment planning, and assessing treatment response. In a video discussing emerging therapeutic approaches in acoustic neuroma management, several exciting possibilities are highlighted. Targeted therapies aim to disrupt specific molecular pathways involved in schwannoma growth, while immunotherapies use the immune system to target and eliminate tumor cells. Gene therapy approaches seek to correct genetic abnormalities responsible for tumor initiation and progression. Promising preclinical and clinical trial results have been observed with drugs inhibiting VEGF and EGFR pathways, immune checkpoint inhibitors, and CRISPR gene editing technology. Ongoing research and clinical trials are expected to lead to more personalized treatment strategies in the future. The correct diagnosis of acoustic neuromas relies on differentiating them from other conditions that have similar symptoms and radiological features. One such condition is meningiomas, which can appear similar due to their location and involvement of the cerebellopontine angle. However, meningiomas have distinct imaging characteristics, lack dural tail enhancement, and may have calcifications. Other possible diagnoses include epidermoid tumors, arachnoid cysts, and metastatic lesions. Epidermoid tumors appear bright on diffusion-weighted imaging and do not show contrast enhancement. Arachnoid cysts typically lack internal enhancement and have CSF equivalent signal intensity on MRI. Metastatic lesions can appear differently, often showing multiple enhancing lesions in different locations along with a primary malignancy. In challenging cases, a multidisciplinary approach involving neurologists, neurosurgeons, neuroradiologists, and pathologists is crucial for accurate diagnosis and appropriate treatment decisions. In conclusion, managing vestibular schwannomas, or acoustic neuromas, is a complex task involving various aspects like neuroanatomy, radiological imaging, surgery, rehabilitation, and emerging treatments. This video addressed important topics such as vestibular nerve physiology, diagnosing bilateral cases, surgery, and post-treatment rehab. It highlighted the importance of accurate diagnosis, patient quality of life, and future therapies. As medical students, this script has prepared us to effectively manage vestibular schwannomas, leading to better outcomes and improved quality of life for patients.